You might buy a new mattress and still toss and turn or try different pills to help you sleep. For a lot of people, that's hardly ideal. The real problem could be sleep apnea. By some estimates, 40 million Americans have it. But here's the rub. About 90% of all of those people haven't been diagnosed. Here to help elevate our awareness from sleeptest.com, Elias Kalantzis, joined by Dr. Robin Kahn. It's nice to have both of you on the show today.
Thank you, Maria.
So Elias, I want to start with you. And a definition, what is sleep apnea and what about the symptoms?
Sleep apnea is caused by an obstruction in the upper airway, and it's categorized by repetitive pauses in breath during sleep. Some of the most common symptoms are snoring and excessive daytime sleepiness. And also, a lot of times, a spouse or a partner will witness their significant other stopping breath during sleep.
That happens at my house all the time, where I'm nudging my husband. It's like, I'm afraid he's going to end up with some sort of oxygen deprivation and brain damage because he goes for such periods. What about if it continues to go untreated?
Untreated sleep apnea can increase the chances of a heart attack, stroke, type 2 diabetes, and even sudden death by more than 46%.
So I have a right to be concerned in his case, as a lot of spouses would be.
Absolutely, and you have a right to call Dr. Kahn's office because she can help him.
And treatment options exist. Tell us about those.
Absolutely. Several options exist. One of them is surgical intervention. Another option is a CPAP, which is the continuous positive airway pressure. People are quite familiar with that. The other one is an oral appliance device that maintains an open airway for the patients.
We have a couple of pictures, and I know you brought in a couple of props too, so that our viewers understand. So what is this?
That's a home sleep testing monitor. We have another one here in studio. Basically, the patient takes this home, they sleep in the comfort of their own bed, they come back into the Dr. Kahn's office, and she will get a board-certified sleep physician to read and diagnose the study.
That's just it. A lot of people don't want to go to a sleep lab. They think, how am I going to sleep comfortably there? They want to be able to stay at home. So in-home is valuable in that case.
Absolutely.
We had another picture, too, that I was curious about. It looked very high-tech. This piece, what is that?
That's a oral appliance that maintains an open airway, keeps the jaw forward, and keeps the tongue out of the back of a patient's mouth.
So in what case would this be called for compared to maybe the more severe where surgery is needed?
This is a great example of a treatment option for a mild or moderate apneic situation, or in a situation where a patient cannot tolerate a CPAP.
Why did you get involved in sleep apnea? Was there a call for you?
Very similar to your situation. I have a spouse that also has sleep apnea, and it makes for a difficult night's sleep. But mostly I like to treat my patients in a health and wellness environment and create probably a healthy life for them.
Well, that's what sleep does.
Absolutely.
We know it affects everything. If it's your mood or you're falling asleep at stop signs, whatever it is. What is your goal, Elias, in being here today?
Our goal is to spread awareness, for sleep health. And Dr. Kahn has been very generous to offer all Omaha residents a free in-home sleep test for the entire month of May.
This is incredible. For everyone who contacts you, this is a value on average of $500, so you can appreciate that. And there's no fine print, no hoops to jump through. You just mention the morning blend and you'll be able to get that in-home sleep test. So if you know that you've been having problems, if your husband or your wife has been nudging you like I do at night with my husband just to kind of kickstart him and get him to breathe again, this may be up your alley. So what can they do? Our viewers who are watching now, is it that simple, just calling?
They could call 1-800-SLEEP-TEST or visit the website sleeptest.com. There's a morning blend icon they can click on, submit their information, and someone will contact them directly.
My father-in-law has done the lab testing, and so I kind of have a little bit of a foundation there. How is that different than the in-home?
Well, the overnight test at a lab is called a polysomnograph. You physically go to a lab or a hospital, sleep overnight, they connect you, and a sleep tech watches you sleep all night. And the home sleep test is basically done in the comfort of your own home. It's a less detailed look at a more accurate night's sleep, typically.
So then what happens once you get that diagnosis? You're looking for interruptions throughout the night. How many times are you not breathing? How long is it? Those are the things you're looking for?
Absolutely.
And then you decide which device is best to help them get that sleep.
Correct.
Yes.
And Dr. Kahn, being a dentist, can't diagnose. She gets a board-certified sleep physician to read and diagnose the study. And together, in a multidisciplinary approach, they help treat the patient.
Well, technology has come a long way. Years and years ago, there was the big machine and it made a lot of noise and the whole thing. You thought, well, if that's all there is, then maybe I don't want that. This is great stuff, and to be able to get toward that diagnosis and save the $500 along the way, thanks to Dr. Khan and sleeptest.com, and you'll be able to do that throughout the month of May. So if it's not today, if you want to have a conversation at home over dinner tonight or tomorrow, and make sure that this makes sense for your family, but make sure you're doing it in May so that you're saving the money. We have some information here about sleeptest.com. This is the website. It is just sleeptest.com. There's also an 800 number. It's 1-800-SLEEP-TEST. Easy to remember, easy to get to the site. Otherwise, we've got it linked back from our site. It's omahamorningblend.com. Elias, it's nice to meet you.
Great meeting you.
Thank you for coming in today.
Get your husband some help, please. Have him call Dr. Khan's
We've been
office.
talking about it for years, and I'll even add one more point about him. At the beginning of the year, he made a promise that this is the year he's going to take better care of his health, and sleep was part of that conversation. So thank you for bringing this to us.
No problem.
We'll be having that conversation ourselves at the dinner table. And Dr. Khan, it's nice to have you on the Morning Blend.
Thank you so much.
Thank you. All right.
Thank you.
If it's not you, but someone you care about, as I care about my hubby, my benefit from this visit, you're welcome to share it by email or on social media. We post clips after each show online at omahamorningblend.com. Just copy the link. Now we'll toss it over to Kayla Thomas with this week's Wednesday website.